This is Steve Zeltzer with Work Week here in San Francisco, and this is a national discussion we're having around the COVID crisis for working people, the unions, and how workers are fighting to protect themselves, their fellow workers, and their families, and the role of the labor movement, what it should be doing, what it is doing, and what we have to do. So thanks for joining us on Work Week today.
Seth Rosenberg. I'm also a train operator in New York City Transit. I'm a shop steward with Local 100. I'm a socialist, revolutionary socialist, also part of a progressive coalition of within transit workers called Local 100 Fightback.
I'm John Ferretti. I'm also one of the co-founders of the Local 100 Fightback Coalition, and also a revolutionary socialist. And we've been involved with trying to educate workers about their rights on the job, the right to shut down unsafe work, their right to be quarantined if they come in contact with the virus. And right now, there's a lot of action on the part of transit workers on and off the job to defend themselves. And Jay can tell us more about that later.
Yeah, this is Gabriel Prawl with Past President of ILW Local 52, co-convener of the Puget Sound Million Worker March and president of the Seattle chapter of the A. Philip Randolph Institute.
This is Cheryl Thornton from San Francisco.
Okay.
I'm an SEIU 10-to-1 member, shop steward, and vice president of the community chapter. And I work in the San Francisco Health Department.
Welcome, Cheryl.
I said I'm SEIU 1021. This is Brenda Barrows. I'm the chapter president at San Francisco General Hospital Miscellaneous Chapter.
So Jay, talk about the work you do and your whole struggle in your job around the issue of your conditions and you're fighting to defend yourself and fellow workers.
Our work environment is definitely a work environment that's not one that even fits the standards that the governor has pretty much mandated everyone to follow. Like, for example, I would say even just a simple social distancing is basically impossible with any of the work locations that we have. I mean, most work locations are probably, most of us have living rooms bigger than our crew rooms. And like at least close to at least half of our work locations, right? And transit was definitely late to the game with even some of the simple things that may have even just been a moral boost, like hand sanitizer or mask. So the point I was making that I don't have to dwell on too long, even though I think it's still an important point, is that even just as far as resources like hand sanitizer, alcohol, spray, wipes, those things, like most of my coworkers know, I've kind of always been the guy that has that stuff. Like that's just me. Like I'm the kind of guy that, and this is not necessarily because of the virus or anything, but I kind of always felt uneasy even as it was kind of in the news, because I have to say a lot of the progressive news on YouTube was actually covering the story way more than anything on mainstream media. Like if you watch a lot of progressive news on YouTube, they were talking about this story in December, January. CNN probably barely had it on their news coverage. And they have way more resources in there 24 hours a day. I mean, if they could talk about an airplane for 7 days a week, 24 hours a day that went missing in Malaysia, they at least could have talked about this story a lot earlier, and especially with all their power, put it in the news and then have everyone follow, right? And they definitely dropped the ball on that. But I kind of digressed on that for a moment. But, I think even some of this could have been alleviated just by them having resources for us, right? A lot of our coworkers don't really carry sanitizer and alcohol and all that stuff with them. So think about how many people may have even just caught COVID because transit didn't provide them with alcohol and hand sanitizer stuff from the beginning of March, the end of February. I mean, like those are simple things. Like another thing that also bothered me, I'm kind of probably jumping around for a moment, but it has to be said. Like we were having discussions like in like early March about people possibly getting in trouble for wearing a mask. Like that was crazy. Like now they almost try to act like well, it was kind of always okay. No, it's not. Like, one of the things that sometimes has bothered me the most is, like, my health comes way more above any kind of uniform policy. I'm sorry, right? Like, if transit doesn't issue me a jacket that's going to keep me warm, I'm wearing my own, right? If transit doesn't issue me a shirt that allows me to be comfortable, then I'm going to wear my own underneath it. I'm going to do something. I'm going to do whatever I need to do to make sure I'm comfortable so that I can do my job safely, right? So they didn't even provide. I mean, sorry, we were having discussions amongst each other about whether we're going to get in trouble for having a mask on. I mean, it was kind of like basically them putting it out there, even amongst supervision. I remember they even being a bulletin. I don't have the exact details for it, so I'm kind of just talking off the top of my head about it. But there was a bulletin basically hinting at it not being part of your uniform. I mean, this is like in March when people were catching it. China had already been going through stuff. People were already dying. And we're having discussions about whether we're going to get in trouble by the damn mask. I'm like, are y'all serious? So that in its own kind of shows the mentality of it when, you know, basically shows the mentality behind it. I mean, I think that definitely was something that bothered me probably a lot more than others.
I just wanted to, you know, pick up some on what Jay was talking about. I think that, you know, Jay also was not informed that coworkers at his job, at his work location had tested positive, and transit knew about it. And they weren't even going to inform him that he may have been exposed and needed to be quarantined. And he's not the only one. I mean, everybody working at that location was potentially exposed. And Jay played a role in letting people know that, you know, this was very possible. And because of that, that subway line is shut down. And workers who wouldn't have been quarantined are quarantined. And it's really like disgraceful that our union leadership has been AWOL, has been absent in the kinds of just the basics of letting members know they could have been potentially in danger. And it's been left to militant trade unionists and workers, and also it's been left to socialists, people who fundamentally have a wider political perspective, to lead on these fights. You know, look at the nurses who are leading these protests. It's not a coincidence that it's these nurses in particular that are leading these fights. It's because they have a wider understanding of the links to the overall society and how our lives are risked every day by the system of capitalism.
Steve, this is Cheryl. I do have a question for Jay, or a comment. So in San Francisco, prior to the COVID hitting in March, we were given a memo saying that if we had flu symptoms, we had to wear a mask at work. But as soon as the COVID hit, they took the mask from us and said we were scaring the patients. So I really think that all this mask business was about the fact that there was a shortage and there was no real planning for this pandemic. And secondly, I feel like our union should have and should be giving us protective gear and suing these municipals after the fact. We were just sitting out here on the front lines getting infected, and no one is really doing anything about it, including our union.
Unions nationally have not demanded that the employers, and particularly essential workers, get masks. They're calling on Trump to do it, the government to do it, but basically these companies could be forced to do it if workers take action collectively and nationally. And UPS, William Riley Fernandez, he hasn't got on yet as far as I know, but in New York, he works at a barn in New York, and workers were not even being told that they were contaminated. Managers were being ordered to come to work who had 104 fever, and the union was nowhere to be found. There was no warning to workers about the need that the union has to demand that the companies do it. And if they don't, they need to take work action. I mean, what we're talking about here is a catastrophic situation in which, because we're essential workers, transit workers, Amazon, UPS workers, postal workers are not being protected, you could have the collapse of the transportation system, which would mean that supplies that are coming to people are not going to get to them. People could die. A lot of people could die, food, other things. So the fact that there's no protection really of the of the transportation system and essential workers means that you could have a complete collapse of the economy. That's what we're facing. And that's a dire situation. And basically the union bureaucracy has failed to organize to defend us, and workers have to self-organize if we're going to actually make the changes that are necessary, as I see it. I mean, that's what's happening. If we're going to be protected. There are masks, but even nurses can't get masks in San Francisco. In March, I did a show at UC San Francisco where they were requiring the nurses to reuse their masks, which is against the Cal OSHA regulations. But what's happened in California is that they're going along with the CDC regulations, which are very much weakened. And again, the unions are not demanding that Governor Newsom, the governor, keep Cal OSHA regulations, which require these healthcare agencies to provide masks for their workers and not reuse masks. So it's a political struggle that we're in for our unions and workers to demand action and to back it up.
I wanted to maybe comment on a number of things that were said there. I totally agree that the the stuff that it was a shortage of masks that or at least shortage of masks among masks. They off a lot of companies, like tech companies, have a ton, but they aren't in the hands of they aren't in the places where they need to be. And so New York City Transit, the hospitals all weaken their rules and so forth using the CDC to say, oh, well, you don't need a mask, or you only need one mask a week. That's where we are in transit right now. They basically, finally, they're all touting the fact that we have masks, but they're giving us one mask a week and that we have to clean it and so forth. And, let me add to some of that into what Jay said. Early on, I was out. I had some leave that, for, it would be spring break week here at transit. And so I have some, I'm in now, but back when I was at work in early March, I went to my superintendent. And so it's not just masks. It was basic sanitizing measures and basic safety measures that the transit authority refused to put into effect. And things like, 20 people can use the same handle, the same buttons and controls on a train each day. And I said they need to be sanitized after each one, but they don't have the cleaners to do that. They didn't have the wipes to give us to wipe down. And so they basically, my superintendent literally said to me, he said, no, that's not our responsibility. You have to bring your own stuff to clean our trains. And I said to him, I said, that's insane. I said, I totally disagree with you. You're going to get it doesn't even work for your own interest. Everyone's going to get sick if you would go the way that you're going. So there are all these measures that they could have taken. It's not just about masks. Our chairman, Patrick Foy, has really gone into damage control mode when the statistics on transit worker deaths have come out, and infection rates way above most first responder groups, way above New Yorkers in general. It's an absolute condemnation to show that they threw us to the wolves, that they didn't even do the basics, and so we all got sick because of that. And yet they're in damage control mode saying, oh, we followed CDC regulations, we did everything. There's a ton, there's a great deal of evidence to show that early on they could have taken basic safety measures, but they didn't, right? And so now we're in a situation that's pretty complicated because so many people are out sick, so many people are quarantined, and people going to work. So there's a crippling of service because of so many people being sick, so many people calling out sick, that the people who are left to work are required to do more work, and the trains are more crowded, and so there aren't a lot. We have proposed solutions. We sent them to the MTA saying you need to actually shut down service even more and only have credentialed essential emergency workers being allowed on the system. They refuse to consider that. They refuse to consider isolating our train cars so that we don't have to share the air with passengers. That's being done in the DC Metro, and something equivalent is being done on buses to keep people away. And so I think to generalize a little bit, where we are now, we're seeing it with nurses, we're seeing it with Amazon workers, we're seeing it with fast food workers, we're seeing it with farm workers, that capitalism is telling essential workers nothing. We're not going to do anything, the basics to protect you. Because the system has to keep running. Your service, your labor is essential, but your lives are expendable. And so we're going to make you keep working, and we're going to let you get sick, and we're going to let you die. And we hope we have enough people to continue going. And so no one's coming to our rescue. Another thing to say is when I talked to my superintendent, he told me to talk to my union. I sent them a letter that day laying out all these things. I never heard back. This was almost a month ago now. And I never heard back. They've never fought publicly for any of these measures. They've never criticized the MTA publicly on any of these measures. They've never criticized Cuomo, our governor, who they're very tied to. And so our employer's not going to protect us. Our union's not going to protect us. The politicians or safety agencies aren't going to protect us. As Steve was saying, I think we as a working class have to realize the only people who are going to protect us are us. And the way we're going to have to do that is to organize collectively and try and resist working unsafe, right? To try and shut down unsafe work and make demands and say, if our labor is essential, then our lives have to be essential. And so we have to figure out, we're trying to figure out what the next steps are to do that, to try. And this call is a great way to organize with nurses and other workers to try and figure out and get the message out that we need to think about days of action. We need to think about things we need to do in order to force the system to value our lives, because they don't. And it doesn't matter to them whether our families get sick or we get sick. And so we have to make them say, we matter. We're not going to work unsafe. We recognize the value, the social value epidemic of trying to get all this done. It's necessary for people's lives in order to accomplish that.
Absolutely. For those who don't know, my name is Chris Smalls. Formerly worked at Amazon, JFK, Staten Island. You may have heard about me all over the media, all over the news, national TV, with a walkout I held on March 30th. Basically standing up for the employees, as we were all discussing. Amazon failed to protect their employees. So I felt it was my duty to try to stand up and protect everybody. So I mobilized a walkout, and it resulted to my termination, publicly known. And right now, I'm in the media because there's a smear campaign, including Jeff Bezos, the richest man in the world. They have a vendetta against me. And my job right now is to do what you guys want to do, mobilize and form a coalition in solidarity with all the unions across the nation to make sure that capitalism doesn't win. They didn't take care of us during the pandemic. And as you know, this is a widely known situation that we all have to deal with. We have to live with. And it's all about saving humanity for me. And I feel like the union is the best way to do that. It's the best way to take care of our people, our frontliners. And also, it'll help hand in hand with the first responders.
Just wanted to say, how brave you were, Chris. This is Seth. I just want to say how brave you were and how much respect we have for you and your action. I think it's going to send shockwaves to workers throughout the country. We're in solidarity. We're really proud of you.
I appreciate it. Thank you so much. I mean, and this is all new to me. I'm taking this all in, embracing it, and I'm learning about the organizations across the nation. So, like, any knowledge that you guys have to share with me, I'm more than open. I appreciate the opportunity to give these people a voice and be the voice of the people.
Actually, going off of a point that Chris made for something I wrote down, I didn't want to forget. I guess, we all like a little bit of sarcasm every now and then, right? And from what Seth mentioned earlier about them not even having resources for us to clean out the train, the way sometimes the rules work is so funny. It'll probably be a bulletin out a month from now where you get in trouble for not sanitizing the train cab, right? So the same thing that they didn't even allow you to do or have the resources for you to do, you'd get in trouble for not doing a month from now. So that's just crazy, right? I mean, because part of what makes me think that they may have brushed that off is because having to sanitize, because think about it, not even just allowing you to do it is one thing, but they should have even been enforcing it in a bulletin to enforce for everyone. The same way they have a bulletin about somebody wearing a Yankee cap or whatever it is that they're not supposed to do. They should have had a bulletin instructing everyone to sanitize their train cab before they operate. Or of course, what will that do? That'll delay the service by a couple of seconds, not every now and then, right? Because it's going to, instead of trains being in and out, then it may take a minute or two, right? Because most of us operators know sometimes you bring a train into the station and there's lights for that the next crew to take that train out before you even made the train stop, right? So I am being cynical, but they definitely give you an essence sometimes is where the trains moving are more important than your health. And the thing that really bothers me about it is to probably be maybe even a little unfairly cynical, that for the most part, you have people that don't have to bear the consequences of what we have to bear, right? Who are mostly working from home now, and they're in their comfort and safety of their own surroundings, dictating, and at least in the past, dictated things to us that made us less safe. That's not right. Like, how for them to not even see that is a problem. You know what I'm saying? Like, it's like even from what Chris mentioned earlier, right? Like, if you knew an employee had tested positive for coronavirus, I could see Amazon having a bulletin a month from now. You would get in trouble if you didn't tell them. So this man got fired for doing something that you probably would get in trouble for not doing a month from now. That's crazy. How do you not see that? Like, to be better than that before it gets to the point of people having to complain. That's what some people in power and supervision are there for, right? At least that's what I always thought.
And of course, the government, which wants these workers to work. I mean, Trump has said, go out and start working. The government is refusing to order these companies and agencies to have PPE for their members. So they're saying workers are essential in this country, but we're not going to order you to enforce the health and safety standards. And here in California, Cal OSHA only has like 200 inspectors, less than 200 for 18 million workers. And Cheryl Thornton tried to get masks, and they put her outside with people coughing on her in front of the building without a mask. Cheryl, do you want to talk about that?
Hi, Steve. So I work for the Department of Public Health in San Francisco. And March 30th, they ordered us to go outside and screen people for cough and fever, possible suspects of COVID. And at the same time, our site was a testing site for high suspects of COVID. So they put us outside with no PPE. They didn't give us the proper tools to do this job. In fact, they only gave us, they rationed me 5 masks to give out total for the patients for my shift. So of course I ran out the first hour. So at the second hour, I was left to my own, and a patient came up who didn't speak English and didn't know to stop 6 feet back and came up to the table and coughed on me. And so I reported it immediately to my supervisor, and I filed workman comp papers. I haven't had any symptoms, but they took me off of work for 14 days, my supervisor. They did not assist me in getting any tests. They didn't care if I infected someone in my household. They didn't care if there were people in my household living with underlying diseases. They just sent me home and blew it off. So I'm supposed to return to work next week, but I did file a complaint with Cal OSHA, and the complaint the city received a letter. So I feel like they retaliated because now they're stripping me of all my duties. So this is what they do. And this is what we get for fighting for PPE. But like I said, 2 months ago, we were told to wear masks if we came into work with cough or fever. I really think that all of this has to do with the fact that there was no planning for a pandemic, and they just didn't care, and they left certain people behind, what they call the blue collar workers. And the workers that are getting impacted the most, who can't go to telecommuting or anything like that, are Black and Latino. Brown and Black people are left on the front lines. They don't care about our families. We're the lowest paid. We're always subjected to the worst working conditions. And yeah, Cal OSHA's not even really stepping up to do their part because I guess, like you said, Steve, they're understaffed.
Also joining us is William Riley Fernandez from UPS in New York.
Yeah, listen, I'm sorry, couldn't go through, but I also have, is Adam Field there? Adam? Yes, I am. Brother Steve, this is Brother Adam Field from New York City. He was a former steward and a safety advocate over here. He's no longer a steward. He stepped down because of, what that's going on or not going on. So he can give you in-depth information in regards to something very important, what's going on at his facility at Queens, Damascus.
Okay, Adam, why don't you talk? Let us know what's happening at Queens UPS facility.
Sure. I was on a vacation for 2 weeks. I come back, they don't give you no mask, no gloves, no hand sanitizer, nothing. Then they bring a supervisor back to work before his test results came back. And then he goes back to work for 2 days, and then he tests positive, and he had to go back out. It's going on all over. They want the people to come back without even waiting for their results to come back.
Oh.
You know, to me, I just don't feel that they care anything about it, people's safety.
And William, why don't you talk about your story, because you're the former Health and Safety Director of Teamsters Local 804 in New York City. You've been trained, you've been educated about protecting health and safety. What happened to you at your barn, and what did you try to do to protect the workers and yourself and your family?
Good afternoon, brothers and sisters. I'm in the middle of helping Mom out right now, so I'll talk very briefly. And I want to make sure that people understand, the safety advocates, the brothers and sisters that are online, that this is not throwing anyone under the bus. This is something new for all of us. But the problem is, and Adam understands this also from his facility and his barn, his hub, in that there was no protocol, nothing in place from UPS, no PCMs. No one took this seriously. Very few of us were starting to say, you know what, this is more than the flu, right? The present executive board did not hire a safety director, health and safety director. Nothing was happening. I started to hold on to broken Clorox bottles and things like that you're supposed to shot, right? And no business agents were showing up. Adam can tell you on his side, no one was showing up. Finally, I had to get aggressive, and it got the attention of the president of our local. And he said that in an interview with the New York Post, he said that it's unavoidable. I ripped him because he came to 43rd Street. I said, listen, we know each other for many years. We can work together, but, excuse my language. I said, this is fucking bullshit. Our members are getting sick and nothing is going on and no business agents are showing up. What are you doing? So finally, that afternoon, about 5 hours later, and Adam can attest to this, there was a text from the president of our local, Vinny Perone, and Vinny said, William, we were able to locate N95 masks. They got a photo op. Everything is great. Listen, if there's anyone who's a member of the TDU, I was a member of the TDU. I was their poster child 15 years ago. I don't have a problem with working with them or anyone because this is serious. People are dying. People are getting infected. But with that said, I don't need politics. I don't need that. We don't need that. So for obvious reasons, some of us are now taking off. Some of us are now applying for the COVID-19, which UPS will pay you 2 days full salary. But other than that, now one of our business agents is sick. The same one that was saying, well, we're going to get our members' gloves. You need education behind this. I did tell him, I did tell the president of the local, I said, Vinny, listen, now that we're on good terms, if you need me, not a problem, but we need to at least threaten UPS with a 1 day work stoppage. At least a 1 day work stoppage. Listen, we all understand on this phone call that the heroes here are definitely our doctors and nurses and the EMS, right? That's understood. We all understand that. But you know what? We have farm workers, and we have truckers and warehouse people. And people don't know if it's not shipped, it's not getting to its destination. So, ironically, the ones that are not being paid attention to, which are the shipping industry, is the most powerful one. We know that when Ron Carey went on strike in 1997, it paralyzes the country. Of course, we don't want to go on strike, but you know what? We need to threaten them with some kind of work stoppage. And Vinnie Perrone told me, I'm not doing this. I'm not doing that. I said, threaten them, for goodness sake. So, and he says, well, I don't see a problem. I said, why don't you fucking come at 6 p.m. when you see, and Adam can tell you, part-timers working elbow to fucking elbow, Vinny, bagging and sorting and working next to each other. We have a clerk that came in coughing with a fever, and thank God that we had a good shop. We have a good shop with 43rd Street that went up to the division manager and said, if you don't tell this fucking guy to leave the building, all of us are walking. Now, this is a shop steward. And you know what? Management told the guy, you got to leave. But that's the power that the union has. But other than that, when management tells the supervisor, you come in, you come in. I've seen supervisors come in crutches, okay? But you know what? Coming in crutches is not going to get us infected. That's what's going on. And I'm very angry and I'm passionate and I want to work with them. I want to work with the TDU and I want to work with. Listen, everyone in IBT, I've been in contact with the IBT because I got in contact with someone else that said, "Oh, really? They haven't contacted you because they were not contacting Vinny, according to Vinny." So I said, "Well, you know what? I have my contact." And I called them and they did respond to me. And I called Joint Council 16 and they did respond to me. Okay, but other than that, I'm not seeing anything, any political action. We need a work stoppage. We need our union, elected union officials to be on these type of conference calls. They have the power and authority, but you know, if it's we the people, then listen, we have to do what we have to do and push them. And you know, listen, we're all in this together, and I think Vinny understands that. You know, we have an open dialogue right now, but it was only after I had to, you know, put my foot to their throats. And he told me, listen, you know, he wants to, you know, do something. Okay, then let's do a one-day work stoppage. Let's do something more than that, because just complaining is not going to get anything solved.
So from my vantage point, I'm actually an officer in the union. I'm on the e-board. I'm actually not a decision maker as far as like in the top 4 of the people who actually speak and ensure that things happen in the union. But I'm on the executive board, which is the supreme governing body of the union. And anytime the union does things that are not in our favor, the executive board is basically supposed to come into action and ensure that what the will of the people is carried out. So currently what we're seeing on our end is right now, our death toll is almost up to 60. And we have more and more people that are in the hospital and severely sick and on the verge of death. And we right now are not hearing anything from our union president. We haven't heard anything. It's just quiet. We're just getting emails of the people who are passing away. That's what's happening right now. I'm really concerned because I just survived coronavirus. So I'm a coronavirus, a COVID survivor. And what's bothering me about this is that as someone who has survived it, I'm still on quarantine. So I can't really go out and do too much in regards to actually informing the members on what it is that they need to do to make sure that they are protected. One of the actions that they can actually take right now is documenting. No one has instructed our members to fill out injury on duty forms, which would document that they were infected on the job. Also, not only the injury on duty forms, but the when something, a safety dispute resolution form, but not receiving the proper PPE. So they're receiving one mask, being told to use it for 5 days. After they use it for the 5 days, they'll be issued another one the following week when they report to work. That is unsanitary. After you use a mask, it's supposed to be immediately disposed of along with the gloves. What we're also seeing is that our governor, who is being touted as a hero, is a murderer. He knows exactly what is taking place. He knows that nurses, doctors, police officers, correction officers, all of the essential workers in New York City are not receiving PPE. He has his office of procurement has been rejecting PPE from distributors who have contacted them, letting them know that they have masks, gloves, and whatever else that is needed ready to give to our workforce if they would just buy it. And they have been rejecting it. If you watch him when he's giving his if you listen to him closely, whenever he's asked about New York City Transit or any other of the essential workforce, he gives that to someone else to speak. He doesn't want the soundbite to come from him saying that he's not going to pay out death benefits for line of duty death benefits, things that already have been won in our contract for our workers who die in the line of duty. He is trying to reject it. He's saying now that he wants our workforce to have to go at the families of our dead to now have to go after the federal government in order to receive what is already due them. We were all infected on the job. All of us were infected on the job. If they actually show the call records of how people began to go out, it will show you a domino effect of when it started happening. 2 days before before I went out, I met with the union leadership about it because I had been receiving emails from workers who were in the hospital testing positive. They told us that they cannot confirm that these people had tested positive. So therefore, because they couldn't confirm it, meaning that it had to, if you tested positive, it had to first go to Albany. Albany had to say that you were sick in order for it to be recognized as you were actually sick. This was their way of covering themselves from not doing anything. Not so much our union, but this is what was coming from New York City Transit Authority as the way they were verifying who in fact was COVID. They even had a live stream where they told us they would not give us masks. They would not give us PPE because of what the CDC said, even though they've had a plan in place since 2012. This is criminal and it is now murder. To put people in this type of environment with a disease that is airborne and spreads rapidly. Not to mention, we're being lied to about how long COVID stays in your system. 14 days is just the incubation period for COVID to basically do what it's going to do. If you survive those 14 days, that means your body now has the antibodies, but you are still contagious. It takes between 33 to 41 days for the disease to actually leave your system. The reason why they won't retest, because if they retest, everybody's going to come back positive because they're still infected. I'm now on day, I think, 19. I've been fighting for at least 3 days now to get retested. I finally was given a phone number to a doctor who would retest me to make sure that I'm not still positive because I'm a union worker. As soon as people see me, they're going to start talking to me. They're going to want to engage me. I'm going to be then in contact with the public. And if I'm still contagious, my droplets are going to infect people whether I want it to or not. So this is wrong and it's criminal. I have a friend who was a nurse who was ordered to stay at work. I told her, you leave and you tell them that you're sick and you're not coming back. She's still home on quarantine, recovering. Nurses have been going back after their fever has subsided after 3 days, still sick, infected, treating people who may not have been infected or coming in contact. There was a gentleman who had a heart attack. His name is Shelly Johnson, a mild heart attack, which you would usually recover from. After going into the hospital, contracted COVID, had a series of heart attacks, and he is now dead. This is what is happening right now is murder. They know how this disease works. They're acting like they don't know how it works. When I went to go get my doctor's line signed for me to return to work, I asked the doctor to put cleared. If my lungs, I had bilateral pneumonia as well. If my lungs are fine, if I'm healthy, if I can go back into work, I need you, doctor, to write, this patient has been cleared. She would not write it. She would not write it. She gave me something telling me, oh, since you still have symptoms, maybe 7 days to 72 hours, depending on, since you don't have fever, you just have a cough. A cough means that I'm still contagious. It's a symptom. So how are you clearing me to go back to work? I'm gonna kill my coworkers if I go back to work. This is how serious this disease is. I am an African-American woman. I'm an essential worker. The numbers show that my people, anybody that is Black, Latino, Asian, even white, if we come in contact with each other as an essential workforce, we are more likely to die because we are the ones on the front lines. So at this point in time, if something is not done, if the real facts don't begin to come out and how COVID-19 actually works, we're gonna see the second wave that Fauci already said about a week ago. He said once the curve flattens and they let the people back out, there's gonna be another wave of sickness and infection and death. The mayor of New York City said that he doesn't want that the kids are out for the rest of the year. Our disrespectful, evil governor wants to continue his little fight with him and says he doesn't know if school is gonna be out for the rest of the year. Everybody is in danger. This is a real epidemic. And not only that, the doctors are even reporting now that they've got it all wrong because they've been using ventilators when it comes to COVID, the cells are deprived of oxygen, pneumonia sets into the lungs and swells them, and that's how people die. So instead of treating them with ventilators, they need to be treating them with vitamin C, which we know cures the common cold, takes away inflammation, and they want to use steroids along with the vitamin C. So we are in a real desperate situation. Our union has been quiet. I thank you for giving us the time to come on here to talk about what's happening, but we are definitely in a state of emergency in New York City Transit Authority. No city agency has as many dead as we have now. No city agency, and it has been reported, but the way they report it, they do not talk to the workers. They just make a report, they flash, maybe talk to one person or whatever, and then it goes away. This is more serious than what is being touted. Our governor is a murderer. He is murdering and then he even said today, I'm sorry, I just want to say this one thing that he said today. He said he speaks to the hospitals every day. There must be a disconnect between what the hospitals are reporting to him and the nurses who are telling them they don't have PPE. So instead of sending a box, why not send more of what it is that they need, not what they need day to day, but ensure that they have what they need to work and not infect and continue to communicate this disease to the rest of the public. This is just criminal.
Okay, well, thanks.
I just wanted to ask the brother from UPS, talking about a work stoppage. We have some safety rules at the Chicago Transit Authority that can justify, stopping work, a sit down and walk out. If the manager says, no, you have to do it, you have to do it. you know, and if something is unsafe, we're supposed to tell them per the rules that this is an unsafe condition, or I don't have the right tools or the right SOP. They're supposed to fix that for you. And if you do it, well, then you're in violation, right? Do you guys have any rules at the UPS that you can use regarding safety?
Yes. Yes. If you don't have the proper, let's say, a hand truck that's not properly working or whatever of that nature, you got in contact with your shop steward. But so we do have provisions in our contract that if it's unsafe, we can refuse to work. And also under Article 37, I think its age and physical condition have to be taken into consideration. Again, we have that protection here. So if you feel that it's unsafe, you don't have to.
So yeah, that because brother, I'm gonna tell the group, and then I'll just be real quick. So I'm off sick. I'm sick. I've been dealing with this cough for 2 weeks, waiting for my test. I'm a train operator on the Brown line, full time, and I believe I'm on paid leave, but I can't get any answers, so I'm just having faith. But interestingly, 2 nights ago, our car cleaners, our rail car cleaners in one of our terminals at Midway Airport. We have a train terminal, a train and bus terminal at Midway Airport in Chicago. So they had a train to clean. Brought a train into the yard, and they told them, okay, you're going to clean this train out. The car services said, why are we cleaning this train? They said there was an employee on there that had COVID, and we need to sanitize it. They said, we don't have an SOP. We don't have the PPE to deal with this. The manager said, well, just do it anyways. They said, no. He said, no, do it anyways, or you're going to go home. Well, these rail car services, they walked. This was historical, everybody. This was, for our union, this was historical because our union is very anti-action, very pro-politician, very passive. We got an A+ grievance committee, but when it comes to our offense, it's horrible. And I mean, if you talk about action, they want to bounce you out of the union hall, you know? So anyways, they did it. They walked off. The next day, they called our union president and said, hey, this is what we did. The president's like, oh, yeah, congratulations. So the president and the secretary went there with the coworkers, the 4 of them, and basically they got their violations thrown out. So they're not getting any punishment for walking out. The only problem, though, is that our union leadership, elected leadership, refuses to publicly acknowledge what happened. This was a historical event for our union and our company where we work. And none of our union's leadership said anything about it. They posted little things on Facebook, you know, congratulations, but they didn't encourage us to be safe, right? They didn't encourage it. They're scared to death. I think they're angry at us, and they're scared to death of what the management is going to do. But anyways, I just wanted to share that, to let you know some good news, that we had a walkout that was successful in Chicago. So y'all should know that.
Thank you, Eric. And that needs to be publicized nationally so everybody knows you can fight back. If you're organized, you can fight back, and you have to fight back if you're going to save your lives. Eric Slater, why don't you talk about what you've learned? You're also sick as well. There's an epidemic, obviously, of transit workers. Eric?
Yes, I can only speak for a few minutes here. I'm actually at the doctor's office trying to get back to work. I was listening to the executive board member over at Local 100, and I share her concerns about coming back to work with my coworkers. But CTA, the Chicago Transit Authority, is telling me that this is the process that I have to follow. So I am doing so. But I do share the point of many people on this call that the unions and workers' organizations should be taking control of the situation, putting forward the perspective of the real leaders, the real experts of the transit systems, which are the frontline workers. So Just a few things real quickly to recap. Some people may not know. So in Chicago, we have basically the second largest system behind New York. It looks like the virus has hit us a little bit delayed from New York, but we're very, very concerned that what's happening in New York and intensifying in New York will happen to us in Chicago. Our workplace, the frontline workers are about 90% Black, and it's hitting Black workers disproportionately to others. I believe we have an unconfirmed death today at one of our garages. We had another one a few days ago, and I'm very, very concerned. So we have been concerned for about a month. I should say I speak for myself. I don't speak for the union or for the Chicago Transit Authority, but the previous speaker, Eric, and myself are part of a group called Transit Workers Unite that has been calling for actions and having many meetings of workers over the last few weeks in a very hurried fashion as we're seeing what's coming. We did have a victory a few days ago. Let's see, now it's Saturday, I guess it was Friday, yesterday, where the mayor of Chicago was forced to put out a memorandum saying that the buses would have rear boarding, and the bus operators have the authority to continue going drop off only if they had more than 15 passengers on a 40-foot bus or 22 on a 60-foot bus. So that is clearly from pressure from rank and file workers as well as transit agencies looking at what's going on in our cities, I imagine. And as Eric talked about before, we did have one small action by transit workers who walked off the job just a few days ago when confronted with unsafe conditions. And I don't know all the things that are going on, but I imagine that's going on nationally and internationally. And it's very good that we have discussions like this to share this information, because it's really not getting out to the national press and even the local press. So I'm very encouraged. We had meetings with rank and file leaders over with New York, in Los Angeles, even some people from Canada. We're on some of the calls in their building, and they're giving us a perspective, a national and even international perspective. So I think this is helping to bring a lot of the workers together under these severe conditions. So once again, I'll just finish. I share the perspective of my fellow executive board member on TWU with this emergency situation, that the unions need to function as their primary function, which is to mobilize the membership to take action for our safety and for our interests. And it's a life and death issue. You know, we were trying to have an executive board meeting yesterday, and it was canceled, Thursday, and it was canceled. That's outrageous. We need to be meeting, rank and file workers need to be meeting in mass meetings over the phone or the internet like we're doing here, to make decisions democratically, to move our unions, to force things like immediate testing for all transit workers, immediate PPE, not just these hospital level, these masks which actually don't work. You need N95 masks which are properly fitted and properly trained. You need to have testing. You need to have proper cleaning procedures. We're still in a 14-day rotation for deep cleans. It should be every day that these buses and trains are deep cleaned. Those are the types of demands, in addition to making sure that there's no discipline against workers. We have a egregious policy in Chicago where you are disciplined for being sick, even when you have documentation, never mind all the bureaucracy, which I'm currently going through. All this stuff has contributed to the Chicago Transit Authority and Pace Suburban being a vector for the virus and hitting working class communities extremely seriously. So I'll finish with that. I hope this call helps us to build some organization nationally, internationally. Thank you for everybody on the call.
Thank you, Eric, and good luck to your dad, who's also had health problems. This epidemic is affecting all of us, our families, and all working people. So Gabriel, we also have Gabriel Prawl on from Seattle, who is past president of the ILWU in Seattle, and they had, I understand, a work action last Thursday night. And Gabriel, you want to report on what's going on in Seattle? Gabrielle?
Gabriel, maybe you can unmute yourself if you are hearing this. Everybody is on mute now.
Gabrielle? Maybe have to
Yeah,
leave
I
us.
think, is that you, Gabriel, on the iPhone?
Yeah.
Yeah, I'm still here.
Okay,
You
good.
hear me?
Gabriel. Yeah, we can hear you. Welcome to
Okay.
Work Week, Gabriel.
I was kind of getting some other calls coming in at the same time. So I wanted to say thank you to everyone that's been sharing what's going on around the area. I mean, it is critical what's going on, and the fact remains that our union leadership is not doing 100% like they should do. You know, I'm a marine clerk. I work on the waterfront. You know, we moving the cargo coming in and going in and out, and we understand that our job is important because we have to supply people right now that need what they need. But we are being put in compromised position up and down the coast with the work we do. As everyone else, I being concerned about whether or not that equipment, the vehicle we drive on the docks, clean safely for everyone to work on. And I've been limiting my amount of days that I work because of the fear of bringing anything home to my family, especially on the docks. I will say maybe last week. And so let me explain exactly what they're doing as far as prior to last week. I don't start with last week. They had the mechanics, which are IN mechanics, who are supposed to be cleaning the equipment on the trucks. And I went to the job last week, and what they're doing is just handing out one pair of gloves and a couple of wipes to the workers as they enter the terminal. And I know it wasn't, I was concerned because giving just one pair of gloves, I mean, a worker goes to the restroom, take off that glove, and then he has to put that same dirty gloves back on. You know, people thinking just wearing gloves means, oh, you're safe from getting any infection or any what's going on right now as far as that COVID-19, and that's not true. You got to change gloves each time you take one off. You should not be putting on the same glove on because you're just passing on that same infectious disease, whether you touch the pipe, whether you touch anything in the truck or equipment, you are picking it up and you're taking it with you wherever you go. Now, I took it up on myself to wipe the truck down because when I walked in the truck that I was driving, I saw there was white stain on the windshield, white stain all over the truck. So just to say what that was, it was the mechanics, all they're doing is just spraying in the truck and keep going. Spraying in the truck, keep going. Spraying in the equipment, keep going. There's no wiping down is going on. I took it by myself to get some liquid mixed with Clorox and some tissue and wipe down the truck. And the mess that was in the truck was unacceptable. It was so disgusting. And I made the mistake of not taking a picture of that mess that I cleaned. So, as I was so hungry. But then I called one of my coworkers and I told him what was going on. And I said, as soon as you get in a truck, clean your equipment. And this is an all different terminal. And there's only one company that running those terminals in Seattle, and that's the SSA, that's Stevedore and Service of America. And he did the same thing I did, and the same result. The truck was filthy. So I was able to get pictures and post it. And it kind of raised awareness to all the workers because they realized what they've been working in. Now, prior to that, there was one of the managers of that terminal. He actually worked on the labor relations. Got infected with the COVID-19, And that information was not circulated to anyone in the industry. It was kept secret. Only a few people knew, including our union leadership. And they did not relay that information to anyone. Here we are going to work, not knowing what's going on. It happens to be, I would say, 3 or 4 weeks after he's been infected and been in care of recovering. There's another manager gets sick on the job. Someone that works in the same office that myself and many people in my local goes into and pick up our paperwork to do our job for the day. And his boss kind of, when they find out that he was having the symptoms, people was trying to shut it down, and he was trying to get workers to continue to work till they get the results from whether he was infected or not. I believe the pressure went down that maybe someone above his head decided to say, no, we're going to send everybody home and not work the next shift. Well, when we found out later on, he is infected. So these guys was willing to risk people's lives to still work while they get a result instead of saying, let's shut it down. So they're supposed to have shut it down for that night and clean everything down. And then they open back up the next morning. I don't believe there was enough time to clean everything. I don't believe there was enough time to even hear the whole smell of the chemical that they was using to clean. It came to my attention that also there was a mechanic, one of the guys that might be cleaning the truck, was infected, and he was sent home. The employees reported that, we send him home immediately, so he wasn't too long on the job. It's like, wait a minute. Before you start, as we know, before you start experiencing the symptoms, you're already spreading the disease. And it's so arrogant of the employers to say that they remove him immediately, and he not even had no concern that he may have spread the infection to many other workers on the job. Now, in our industry, there's a time when, even before all this, that the employers used to provide these white paper suits to go in when we are discharging cars from the ship, just to make sure that anything on your clothes doesn't damage anything. Stain anything on the cars that we were removing from the ship. Well, they was giving it to us free. Well, we can't even get those right now to wear to put on our body to go in and get in these vehicles. So when we leave, we can take them off and throw them away and make sure we're not carrying no infectious stuff on our body to our family. The fact remains is they're not even providing masks like what's needed. If you don't have one, you're on your own. It is critical because even though as people are dying, I noticed that some of my coworkers are not even educated on the process of staying away from each other. People are having conversations, people are close to each other, and the leadership is nowhere around to say this is not acceptable. They changed the process of how they're dispatching people to jobs, but they're not educating anybody of the seriousness of this. I was informed that after all this, on Wednesday, workers decided to take a stand on standby on health and safety. The employers took it up on themselves to call in the arbitrator to challenge the health and safety stand that the workers are taking. Well, I found out that workers, the union won on that stand, and that the employers was talking about only working one shift a day instead of two. And that was on Thursday. That discussion was talked about. But then on Friday, I'm hearing they're back to business again. They're gonna still work two shifts. Well, they're not hiring enough people to clean those equipment, and here we are. We're back again in the same situation. And I have to question if we got that far to come to the question of working just one shift just to give time for the equipment on the job site to be cleaned, and then in less than 24 hours, all of that changed. So I have to question what kind of agreement the leadership of the union did with the employers to make them go back in business. And that is a problem, because it's clear left that rank and file workers, I have to be the one to lead in making this concern be heard. We cannot rely on the leadership to keep us safe. We have to be keeping us safe. We have to speak up. We got to take the action to make that change. You know, I listened to everyone talking about a movement, to a national movement, to come up with some kind of ideas to make our voice be heard. But I also have to make everyone and call attention to everyone that this is a international thing that's happening. This is around the world, and I believe that this, whatever we decide to move forward on as far as this, the whole world has to be involved in this, because workers all around the world are experiencing the same battle, the same concern, the same suffering, the same fate that we are dealing with today. And you know, I had great concern, and I slept on it many times this week, and got up. I said, what can we do? How can we reach everyone around the world? And I thought about May Day. May Day is coming up, the International Workers' Day. And you know, some people might say, oh, we're too close. We can't. And then I say, well, people are dying every minute, every second. So we got to. I believe that if we got to reach the workers today to understand that there's people on the front line that are dying each and every day. Who is mourning for those people? Who is honoring those people? We have to make a call. And I think that call is right close around the corner. There's no time to wait. There's no time to think about it. Workers need to take the day off, honor those that are on the front line, honor those, mourn for those that have died, and we got to send a message. I mean, as we see what's going on today, and as labor has suffered against the oppression that we have had through capitalism, I think the door is as open for us right now to make a change. And I think we need to seize that time. Okay, it's unacceptable for us to go on. And I don't want to take up all the time, Steve, but I'm feeling passionate about this, because I think it is no better time than now for workers to come together and set aside their differences and fight to make a change.
Week program that ILW Local 10, the longshoremen, have said they're going to have a stop work meeting on May the 1st. So in the Bay Area, I think we're going to work to have a united front of unions throughout Northern California to join on May Day. And I think we have to have clear demands. Essential workers and farm workers and others have a right to have PPE, that people should not be working without protection. And if they get sick, they should go home and be fully compensated. All workers should be compensated. So that's a human right. So John,
Yeah, thanks, Steve. I was really inspired by the gentleman from Seattle, and his intention. But even before that, I was thinking about like how little it takes to really create actions that can be a lightning rod around the country and around the world. If you just think about Chris Small's actions and heroic actions that he organized, it didn't take a lot for that to make international news. Same thing with the nurses here in New York. We had a protest of about 80 nurses outside Harlem Hospital over unsafe work conditions, the lack of PPE, and that electrified the national news media like that, in a snap. Transit workers, need to understand that we're not alone. We all need to see the connections between our struggles. I know that there's an action going on April 14th nationwide of nurses leading actions in various cities, and transit workers should be out there supporting them. But we should also think about that actions can be not as high an ask as necessarily Chris was asked to make in terms of losing his job. It can be quarantining yourself. It can be booking sick further notice and refusing to have yourself further exposed. It can be those who are returning to work from quarantine, shutting down unsafe work, using our contractual protections and our legal rights, and making it public. And we can connect those struggles. And we don't have to wait for May 1st. I understand what the gentleman was saying about, like, people may say it's too soon. I think it's too far away. Like, we need to start right now and have a lot of things building up to May 1st that can kind of show workers that they're not alone and show our power. And I think Trump is it becomes a real ally in all of this, trying to push people back to work as early as May 1st. And he even talked about doing it before then. So that's only gonna raise the temperature and get more workers to see the need for actions, no matter how small, right now.
I wanted to make one last point, because that was tying in that something that was mentioned earlier. I forget who mentioned it, but actually it may have been Evangeline. Because one of the things I'm questioning, I had been on quarantine, right? So I haven't been to work in a few weeks, but one of the things I'm questioning is normally with our job duties. I mean, it's one thing is bad enough with this type of environment and everything that's going on for even us to be as a train operator, and it's similar for a conductor, for us to be in our train cab, operating the train, doing our duties, right? But in most, not in every run, but there's often enough times where you get things that are in our job duties of having to cut out a door, or having a sick passenger, or let's say even less often, but probably a little easier to deal with, not an unattended bag, right? I mean, if you think about it right now, is how do you even handle that? Like, if someone, and really just being funny, because I do take my job serious, but just to be funny for a moment, if a customer comes to you and they tell you there's a sick passenger, when you look at them, I'm like, well, what you going to do? I'm not. What am I going to do about that? Because think about it for a moment. It's definitely an essence of you in your train cab. Is every time you leave that train cab in the middle of your run, you're taking a chance with your life. Because if you haven't already contracted it, in that unlikely chance for even in our environment, you're putting yourself in a situation to have a better chance of contracting it by going outside of your cab into the train car that might even be semi-crowded full of people, right? Now, what if you have to cut out a door? Right? And for those who may not know, cutting out of doors, the doors have a problem. It might be just one of the panels, so you have to use your key in order to lock the door so that the train can then move in service, right? So how do we even do that? The only visual I have in my head is to kick everyone out that car, because I can't see me going to cut out some door with a whole bunch of people around. So it's just like, I don't even know if they've even instructed us how do we do our normal job duties in this type of situation, because there's got to be different. There's got to be different processes. Like, we can't be going to cut out a door. If you get a sick passenger, normally they might have you investigate to see what's wrong with them. But sick passengers, like, what do you do with that? Who of us is really going to go out there to find out what's wrong with that person? like for real. So I mean, I don't know if anyone has like answers to that.
Well, I mean, the health and safety movement, we need a health and safety workers movement, because each union should have a health and safety person. There should be a health and safety committee with giving information out, organizing people to understand what's going on. The unions have not organized to put health and safety people on. The government has cut OSHA, so there's no inspections. They're violating the laws and rules all the time, and there's no action from the government.
Now,
so what does it mean? It means that the working people have to organize. We have to demand there be health and safety committees, health and safety inspectors with the power to shut down jobs. I mean, it's insane to tell people you're going to get sick, you're going to get contaminated, when they know that that's what's going to happen. That's criminal. I mean, I agree with Evangeline, what she was saying. It's criminal what's going on. In California, Gavin Newsom, the governor, the unions are not demanding to hire health inspectors. There are flagrant violations of health and safety rules, threatening the workers' lives, and they don't even investigate. They say they can't come out to investigate. They only have 200 people. And I'm in touch with health and safety people here, and they're being told, don't go out, don't investigate. So basically, they're saying it's up to the workers. You're on your own. Basically, they're saying to working people, you are on your own.
Yeah.
You are on your own. That's what they're saying. So if we're on our own, then we have to organize ourselves to defend ourselves. That's a matter of life and death, if you're on your own. And that's what we, I think, have to say to working people in this country and all unions. If you're going to organize to defend yourself, you have to do it. Nobody's going to do it for you. And our union should be demanding that the government do what they're required to do, which they're not doing.
Yeah. But when you have presidents of your local that tells you, well, we don't need a safety director, that's a problem.
That's right. That's absolutely right.
Yeah, and Brother Steve, can you hear me?
Yeah, I can hear you.
You know, I'm self-quarantining right now. I'm under self-quarantine for underlying health reasons. And like the sister from, I think Local 100, she hit it. I mean, she hit every point on the nail. For example, how can the governor give a briefing and an hour later you see the nurses outside of the hospital protesting that they're not getting PPE? I mean, you know, MTA workers talk because it's like UPSers. And when I saw the numbers of the MTA workers that have died of this, I was in shock. Everybody's talking, and the governor keeps on talking about the curve. And like I told you, you know what? A boomerang curves. And a boomerang can come back at you, and this is just going to get worse. All of us here have been sounding the alarm in our own way. And God bless everyone here in regards to that. But I wanted to mention the part of the GoFundMe, which I think is ridiculous. I think it's pathetic. I think it's sad that UPS workers have actually put a GoFundMe together with the TDU. Are you kidding me? We're on our own.
Yeah, that was a notice that the TDU put out asking for donations to urge UPS to provide PPE to workers at UPS. I mean, in other words, you're going to beg UPS, raise money to beg UPS to provide PPE. I mean, the union should demand that they get PPE, or it's all going to be shut down.
Absolutely. If we have a provision in our contract that if we suspend safety committees, we have to call the IBT. That's not a problem. Listen, you just call Lamont Berg, the head of safety nationally at the IBT, and he gets in contact with the reps above him and say, you know what, Local 804 is shutting down operations. I told him at least threaten them with a one-day work stoppage, because I'm no longer the health and safety director. I'm a clerk in the overgoods department, which is a department basically like hazmat, but it's broken packages where I've been seeing medical equipment. I mean, things that are not getting to where they need to get to. Listen, MTA, they're transporting human beings from point A to point B. People here are talking about their brothers and sisters are talking about their trucks and their areas of work not being sanitized. We got a supervisor who was sick, who has this, and I know the areas because I know all 16 facilities because I was the health and safety director. I know that area, and guess what? I am now self-quarantined, but I'm still getting calls. And that area where that supervisor works, people work literally, I mean, there's no spacing. It's impossible to space anyone apart. And I got the information. Was it sanitized? Was it foamed up? Was it cleaned up? No, Riley. And when I was already in the facility at 43rd Street, nothing was being sanitized. I made it very public that 6 business agents show up the very next day to 43rd Street. And then 5 hours later, miraculously, masks came. Unbelievable, right? It's all politics, and we got to set that aside. But people are dying, like Sister Evelyn, I think, from Local 100 said. She hit it on the point. Everything she said, she was on point, because it's also happening at United Parcel Service. And our business agents have been MIA. And the one business agent that did show up and said, well, your local is going to get you gloves. You know what? You have to be educated in this. You have to be educated in what are airborne pathogens and what this disease is. Okay, like Sister Evelyn, there are some people on this call that actually are going through it right now or surviving it. So, of course, they're going to try to find out more information. That's why you need safety advocates and safety directors at locals, because those are the ones that go into these barns, into these warehouses, and have talks. I mean, from diplomatic talks to what the fuck are you doing to management. But it comes from the top. If we don't have local officials that are willing to say, you know what, we're all going to call each other, the workers who represent those farm workers in California, the workers that represent those other brothers in Michigan, in Seattle, the other brothers and sisters from New York City, where we're getting hit. And you know what? I didn't know until you told me, brother Steve. There was a police officer, a sergeant. He was diagnosed with COVID-19, and right on Park Avenue, 77th Street, he dropped dead from a heart attack. I didn't know that this also can attack the heart. I didn't know about this. These are things that we have to study. We're not getting full information.
See, this happened in China. People were dropping dead because this disease affects your heart. You have it, and it creates a heart attack, and that's why people drop dead. It's not a sudden development. They're sick. They don't know it. They have some problems, and then they have a heart attack. So there are many more deaths of workers and people in this country who are dropping dead, and it's not counted as a COVID death, but that's exactly what it is. So Scott Holderson joined us from Chicago, and also Chris Silvera from New York is on as well. Chris, you want to make some comments?
Yes. First of all, I'd like to give recognition to Brother Smalls, who led that heroic effort. That's number one. Number two, I want to give props to Local 10 for what I know is going to happen on May 1st in the Bay Area. Number three, I just want to let it be known that Local 808 has negotiated a contract in Peter Cooper Village, Stuyvesant Town, May 1st as a holiday for its workers. Now, I'm not sure what's happening with some of these people. We represent transit workers at Metro North, track and bridge and building workers. We have a phone conference every day for the past 3 or 4 weeks where we discuss with the highest levels of the company what's going on, what needs to be done. Just this weekend, there's a guy that got infected by COVID. His work area is going to be cleaned. They cleaned it. They didn't get to certain locations. This is happening this weekend. I reached out to safety. Nobody goes into that area until that thing has been cleaned Monday morning. All our people have PPE, but we are an aggressive union, so we're not sitting by and just watching things happen, right? I know that the MTA got about 250,000 masks and stuff that's distributed between all the various agencies. Everybody at Metro North that, needs a mask, gets a mask. If you come in contact with somebody that is COVID-19, automatically 14 days, you're out paid self-quarantine. So we doing all of these things every day. So these people got to step back and ask themselves, what leadership have you been tolerating? Now, for the brothers at UPS who seem to have a problem, because I called over to Local 804. So I'm going to tell them that there's a guy over there named Chris Williamson, that they should reach out to Chris Williamson, who I believe is the vice president, to see if he can do something, because I'm getting a different feedback from them. Transit, oh my God, I mean, you know, they're exposed to so much. I mean, there's almost 60 of them that have passed away. It's like such a really sad situation. But, you know, they got to fight. They got to stand up. They got to make a demand of their leadership to do what needs to be done. You know, I mean, Local 808 has always been proactive. So, you know, we are on the front line of trying to make things happen. We saw this happening. But, you know, we could be on this call, but you have elected people who are getting paid. They need to step in their chests and make them do what they need to do to get them the things that they have, because I know that the MTA has PPE. Now, I have also reached out to the MTA itself, because I have some connections with people that are bringing stuff in from China, various kind of PPE, which I have circulated to people in the MTA. So they're waiting for me now to get letters of recommendation, because you got to put up half the money. So if you want to buy a tractor trailer full of PPE, it's about $4 million, right? So who's going to give who's going to put out $2 million without knowing who this cat is I'm handing $2 million to? So I'm working, trying to help get PPE for the MTA. So I just want to report some good news, and not what some good news, but things that are being done proactively, and people need to just get up in their union leaders' chests and make them do what needs to be done.
Yes, sir. Brother, Local 808 chairman there. So are you holding daily online meetings with your members, or regular online meetings with your members, allowing them to participate in the democratic process of making demands, making decisions, planning actions? Thank you.
Okay, so I'm not that versed, but I think all my members have my phone number. They have their vice president phone number. So anybody that wants to, you know, we communicate through the stewards. We're putting out information on a daily basis to them, what they're entitled to through, you know, stimulus 1, 2, 3, what the company's doing, what the union is doing. So we have that level of communication. All our locations have stewards. So if there's information that need to get to our members, we put it through the stewards and get it out to our members. Anybody that have questions can call me directly. They all have my phone number. It's a public number, you know, to talk to me.
Well, one of the things that we can use, and we're using this vehicle right here, this Zoom, is you can look like the Labor Council canceled its meeting, its union meeting in San Francisco. The Labor Councils should be organizing all the unions to as a united front to demand PPE for all workers that need it, in essential workers. It's not happening. So one of the things is, if a union, I think unions should try to have meetings on Zoom with their members so people can speak up. Each local or each unit can meet on Zoom and start communicating. We need communication, collective communication. And one of the things Workweek is developing is with Pacifica, a 24-hour day of programming on May Day, and on the docks and ILW and all over the country to report on the struggles going on. How are workers dealing with this crisis? But we need a national 24-hour channel for working people all the time on education. What protection do we need for frontline workers, for essential workers? That should be on our channel. We need a workers channel in this country and internationally that can get this information out. People are dying because they don't have information. They're not knowledgeable about what's going on.
Well,
So,
Steve, they'd have to stop giving money to the Democratic Party. You know what I'm saying? So they need to spend that money on educating their workers on a daily basis. No doubt about that.
The millions of dollars that the unions give to the Democrats, where does it end up? It ends up screwing the workers, because that money is not going to us.
That's right.
We have to say no more money to the Democrats. We need a workers' party. That's my own belief. And we need to have a workers' channel so that we can unite and educate. And the corporations, the corporate media, don't want to get these stories out. They don't want to talk the real criminals because they support them. They're building up Cuomo or they're building up Newsom as great heroes when they're not even defending the essential workers, the workers in hospitals in San Francisco. And the union officials won't attack Cuomo. They won't attack Newsom because they're in bed with them politically. So that is a problem and a contradiction. If we can't challenge, if workers and unions can't challenge the corporate rulers, and that's who they are, you know, how are we going to defend ourselves? How are we going to really, in a united way, challenge politically to defend ourselves on the job? That's really one of the questions that we're confronted with. You know,
well, in New York, they fear Cuomo. You know what I'm saying? So in New York, the unions that support Cuomo fear Cuomo. So I supported Cynthia Nixon. So I don't have that fear of Mario Cuomo. We understand that the party is not a friend of the working class and that we have to develop our own movement. You know, we did Million Worker March. I mean, and we continue to function in that space.
Steve, this is Gabriel. I have a question. First, I want to commend Chris for taking the initiative to make sure that it's a possibility of getting PPI for workers. But my question is, and Mary Chris, is that I work in a multi-billion-dollar shipping industry, and you, Chris, being a labor leader, can able to pull that off. Why is our shipping industry can do the same thing to make sure the workers here in the West Coast and the maritime unions get those PPE when they are close connection to those companies that import and export goods? I mean, it's unacceptable and ridiculous that we are not working around space where we don't have enough supply. I mean, every truck, every equipment on the dock should have wipes. So when our workers sneeze or anything, they can wipe it right on the spot. They are not doing that. They give you 3 pieces at the beginning of the shift and at the shift, and you're on your own from there on. I bring my stuff to work with me, including box of gloves, and I share with other workers. But it is unacceptable and ridiculous that and that shows with the information that you share with us, that shows that those employers are intentionally not caring about the workers. They're not making an initiative to keep the workers safe, and they are putting us at risk. We are playing Russian roulette each time we go to work. And
workers are being killed criminally because they're not being provided education and protection.
Yeah, it was great to hear from Chris, and you know, your reputation precedes yourself. So, you know, I unfortunately I didn't have your contact information. We need to talk about how we can work together collectively. But as far as my union leadership, I mean, they are terrified of the membership right now, and they're terrified of an absolute revolt going on in our union. And the thing that's keeping things static is that union leadership and the role that they play in terms of being a prop for a murderous, racist piece of shit governor in Andrew Cuomo. Cuomo, for example, is responsible for 20,000 hospital beds not being available because he conspired with the hospital owners, the Mount Sinai's of the world, the Columbia Presbyterians, the NYUs, to gut the number of hospital beds that we have and to allow them to basically force everything into urgent care. Because urgent cares are profit centers for them, and that's all they care about. And, you know, so we have to kind of get that message out. And part of the way we can do that is if we can have voices like Chris, voices like the other transit workers like Evangeline and others have the back of the nurses who are on the front line and kind of unite those struggles. Also, what Jay was bringing up about the unsafe conditions, like the situation is ripe for a sit-down strike in New York City Transit over these kind of issues. If you're safe where you are and they are telling you to do unsafe work, we don't move. And the trains don't move. And we fill out safety dispute resolution forms and let the superintendent come down here and put his name and his pass number saying he thinks this is safe. We need to sue these bastards too, every one of them. They are personally liable. They're murderers. They're setting our workers up to be killed. And they have to pay a price in every way we can make them pay that price. So we all need to network and get our resources together and not wait on the union leadership and bring it to their doorstep and everywhere we can.
We also have 1 week on, 1 week off, where half of our members work Monday to Friday this week. They are on call the following week, so we can achieve social distancing on the job. The second thing is we got to remember one thing. The capitalist has never given anything. You have to take it. So we have to make demands. We have to take stands. And Chris Smalls really, I mean, he is the epitome of the type of heroic action that needs to happen. I mean, that gentleman put himself on the line. And I'm telling you, brother, whatever I could do to help you, you got it, because you deserve to have all the help that these unions can give you, besides just making speeches. Speeches are nice, but you need to eat, and you need to end up with a pension when you're 65 years old.
And
so,
these workers who have been fired for standing up for health and safety need to be defended.
That's right.
That's critical. If you stand up for health and safety, you need to be defended and protected, because we need more workers standing up and fighting for health and safety.
Yeah, and just general working conditions. I mean, you know, even after COVID-19 is long and gone, we still need heroic people standing up in the workplace for better wages, you know, better working conditions, you know, pensions, healthcare coverage. You know, I mean, we need to have these battles.
Okay, well, I want to thank you all for joining us, brothers and sisters. Solidarity.